Hi, Dr. Knox, former patient here, and it's taken me probably about 3-4 years to do this video to you because I didn't want to do it in anger. Besides, I had better things to do, like rehabilitation. I was the assistant to Donna Lowe, managing partner at Lowe McKinley, Valerian Salenko. Had been her assistant for a number of years. I came to you because 2 years prior I had had a motorcycle accident. Asphalt right side of my head ended up with stitches here in spite of a visor. And 1 year later, almost to the day, I fell and hit the same side of my head on asphalt. And that's when symptoms really kicked in. I was falling, my voice was slurring, I was having memory issues, exhaustion. My head felt full. I can't explain it. It felt like it was just stuffed with cotton. I was having trouble working. Fluorescent lights bothered me. Noise. I couldn't seem to filter out noise anymore. So, you are our expert. Med mal defense firm. Go see Dr. Knox. So I did. CT, MRI, clear, which now I know, after the fact, are often clear. They will not show anything unless there's a bleed going on or something. You did EMT testing on my legs as well. Asked about the family history, family history of depression, that sort of thing. And you proceeded to tell me that my exhaustion was a classic sign of depression. And I believed you. And it was the one thing you said after the EMG testing when I was expressing a question as to, was there anything that could possibly explain why all this is happening? And you said to me, yes, there's one test I can do. And I thought, great, there's a test he can do. You proceeded to tell me it was an autopsy. Seriously? That is about the most insensitive, cruel remark you can make to somebody who knows something's wrong. But, again, you are our expert. I believed you. I apologize if there's any voice stuttering or slurring. You might notice the left side of my face droops a bit. Hint, hint. And within 2 months of seeing you, I had a complete meltdown. I couldn't work anymore. And then saw a psychiatrist who went with your diagnosis, prescribing medication, which made things worse. I found out later that's the last thing that somebody with a head injury should have been prescribed. And literally, it wasn't until a year and a half later, after visiting my daughter in Europe for a few months, trying to come to terms with, okay, I guess I just fell apart. The expert said so. It wasn't until I finally saw a doctor who did something you didn't do. He did cognitive testing. He did IQ testing. I'm former Mensa, okay? I'm not stupid by any means. I lost a few IQ points. I failed the cognitive testing. Neuropsychological testing. He said, and along with all the symptoms, the same symptoms I had given you, I was informed you have all the classic signs and symptoms of mild TBI / post-concussive syndrome. And I'm like, great, we finally have an answer. But in the meantime, so go through rehab, which has helped a great deal. I'll always have memory issues. I will always have some voice slurring. The light sensitivity and the noise sensitivity is getting better. The exhaustion's still an issue. But you were so dismissive of me, of my opinion as to, I knew something else was wrong. Anybody who's dealt with depression in the past or that sort of thing, we know what that is. I knew this wasn't depression. There was something wrong in my head. And you just blew me off. So I guess I want to do this so that you, perhaps other doctors, don't dismiss people like us so readily. You know, I'm the kind of person, at one point I'm doing my work for Donna full time and then some, handling 17 units at college and taking care of a disabled adult daughter. Believe me, I know what stress is. This wasn't the same thing. So, because I believed you though, and had so much faith in you, I mean, I can't put it all on you. Ultimately, we're all responsible for our own lives and our own decisions. But my belief in your diagnosis single-handedly destroyed my life. I lost everything, Dr. Knox. I lost my job. Had you correctly diagnosed me, done the testing, the cognitive, the everything else, figured it out, given me the benefit of the doubt, I could have taken a leave of absence from work. I could have gone through rehabilitation, and I could still be working today. But no, that's all gone. It's just gone. And I've been through hell and back. And, you know, so please, if you have patients that come to you, you know, don't just do the little physical tests with the arms and the walking and the MRI and the CT and then say, oh, well, you're just stressed and depressed. You know, go see a psychiatrist. Or I can do an autopsy for you. Seriously. Oh my goodness. I have been through hell. And if you care to respond, if you want to sit down and have some coffee sometime, great. I had my opportunity to see you for med-mal. Negligence. I don't think you met the standard of care. You know, but having worked in med-mal for so many years, defense especially, I'm just not big on lawsuits. I figured, okay, it's happened, it's done. We're way past the statute of limitations, so you're talking to me has no bearing on you legally. But an apology sure as hell wouldn't hurt. And just do one thing. Give people a little more credit, and I'd say maybe do some more research on post-concussive syndrome and mild TBIs. Because to this day, I mean, to even go grocery shopping, I need sunglasses and earplugs. If my husband and I go out to eat, we have to choose a quiet time. Restaurants quiet. We do a lot of traveling. I always need my sunglasses and earplugs for that. And that's okay. I can deal with that. What I have a hard time with is knowing that my visits to you and my belief in you completely altered the course of my life and my career. And I wanted you to know that. And any other doctors, whether they're neurologists, general practitioners, I'm getting better treatment now from a phenomenal GP here in Sacramento who's so familiar with head injuries, and she has pretty much saved my life. She has turned everything around for me, and thank God for people like her. So I respect your education, your training, your hard work. I think you're a nice person, minus the autopsy remark. Thank you very much for that one. But think, Dr. Knox, all it would have taken, a simple mini mental would have answered a few questions in a hurry, and more testing from that. But no, you didn't bother with that. You neatly put me in your little category of stressed and depressed and set me on my way. So, there you go. That's all I gotta say to you, Doc. Bye.